Let's imagine better health with CHI Health. March is Colon Cancer Awareness Month. The disease is the second leading cause of cancer-related deaths in this country.
Expected to claim nearly 50,000 lives this year. We wanted to bring you an informative conversation this morning, particularly about the importance of regular screenings.
And it's great to have CHI Health Gastroenterologist Dr. Bob Kizer back this morning. Good to see you, Doctor.
Hey, good to see you. Thanks for
morning.
having me
on
in.
the show before. It's a pleasure to have you
Yeah.
back here. And we're talking colon cancer. I think, is it preventable? I know these screenings are important, but is it preventable?
Absolutely. We have proof. You know, it's tough to really find good proof in a lot of medicine, a lot what we do, but we have excellent data that by undergoing screening, meaning being tested before symptomatic, we can reduce your chances of developing and dying from colon cancer. It is amazingly effective, and colon cancer is still the third most commonly diagnosed cancer in men and women in the United States, and it's preventable. And if you do have it already, if we catch it early, we're talking, can we treat it with a scope versus surgery, chemotherapy, or failure of all of the above?
Let's look at some pictures that you brought in that really show us what a healthy colon looks like, and then, oh boy, we've got an issue.
Yeah, so this is a nice healthy colon. This is the inside. You've got a nice tunnel there, shiny, nice, good vascular pattern. That's healthy. That's what it looks like after the clean out, and that's what you want it to look like. Now this is a polyp. So again, polyps are precancerous growths. So you get one bad cell, and then the body it's like making a bad copy of a bad copy. Then after a while, this is what you develop. Now at this point, that's something I can take out with a scope, with a colonoscopy. If it gets larger than that, well, that's when you start developing actually colon cancer, when it starts eating into the colon itself.
Yeah.
And once it gets to that point, you're looking at surgery, possible chemody.
Those polyps, you basically just clip those off? How does that work?
We have some pretty neat little toys we get to play with through the scope. We basically put a little metal wire around it, run a brief current through, cut it out, and then we're able to suck the polyp through the channel in the scope. And then we can test it to see, is this a high-risk polyp, a low-risk polyp, and that'll help me decide how soon we would need to repeat a colonoscopy.
The screening guidelines, they're somewhat specific for who should be concerned, at what age.
Absolutely.
Walk us through these if you would.
Very good. So non-African American men and women are recommended to have their first colonoscopy at age 50, especially if they don't have any family history. African American men and women, we tend to find more colon cancer and earlier, so current guidelines are that African American men and women begin screening at age 45. Now that's if you don't have any family history of all. Most people that get colon cancer don't have family history. If you do have a family member, a mom, dad, or sibling with colon cancer before the age of 60, then we want you starting at either age 40 or 10 years before. So if you say your brother, unfortunately, has diagnosed with colon cancer at age 38, well, you should get your first colonoscopy at age 28.
Wow. Wow.
And these screenings, how often should they be repeated? I know it's determined by the physician, as in that last point on the screen.
Very good. Yeah. Now, new polyps can develop in time. And so even if I screen your colon, remove all polyps, and you start developing a polyp the day after, then we still have plenty of lead time, so 10 years. Now, if I do find polyps, how soon we repeat is determined a little bit by the number, the size, and then the type, what they look at under the microscope. Might be 3 years, maybe 5 years. There are certain people with genetic syndromes that we actually screen every 1 to 2 years. That's the minority. That's about 3% of people. Most people probably in about the 5 to 10, depending on what we find.
Before the break, Mike said something about younger people. You're seeing more polyps with this. Is it because you're screening more and you're finding them, or is it because more are developing?
And that's something we're trying to figure out. Now, in terms of the screening, the highest risk is still people around age 50. That's when we see it really spike. But we are noticing that there are more colon cancers early in life. And unfortunately, a lot of those, when they show up at age 30 or 40, are symptoms. So if you do start having symptoms, this is things like rectal bleeding, unexplained weight loss, we want you to talk to your doctor as soon as possible. But I don't want people that aren't having symptoms think that that means that they don't need screening. Most people, if you develop symptoms of colon cancer, you've already got it. Whereas if we remove polyps, you're going to not have symptoms, and then we're going to prevent you from ever getting colon cancer.
Yeah, these screenings, I've had the screening. It was a couple years ago, so I'm very familiar with the process, and I know other people out there have as well prior to the age of 50 when it's recommended for whatever family history or whatever. But some people are just reluctant
Absolutely.
What are the different reasons? I mean, what do you hear?
Yeah, I get a lot of them, and I get pretty good at kind of shooting these down. Now, one of the big reasons is the cost. Now, one of the benefits of the Affordable Care Act is that screening procedures are supposed to be covered 100%. So if this is your first colonoscopy, it won't go against your copay. So it is nothing out of pocket, so you don't need to wait until December 31st, cram it in under the beginning of the year. The prep, the clean out. Now we need to get the stool out of you. I know what poop looks like. I need to know what your colon looks like. And people used to have to drink the big gallon jug of swamp water. The preps that we have now are smaller volume, better tasting, and actually split up to eliminate a lot of that nausea, give you a better prep. So the prep's much easier.
The prep's not an issue.
And,
I didn't have an issue with it.
I've actually tested both the big jug and the new ones. It's night and day.
Yeah.
But it also sure beats colon cancer.
Absolutely. The discomfort of the colonoscopy.
And thankfully, so at our sites, we use either an anesthesiologist or a certified nurse anesthetist to provide anesthesia the entire case. And so we can virtually guarantee your comfort. You've got a separate healthcare professional who is only dedicated to keeping you comfortable, unaware, and healthy while I focus on the colonoscopy. So we don't have the problem with people waking up during their scope or having severe pain. That just doesn't happen.
And I can tell you I had that same procedure.
Yeah.
Not a problem. Not a worry either.
Yeah. It works. It's so much better even than 5 years ago.
Would you give us a final word about prevention? I want to bring this conversation back to where we started, because this is so important to you. You've dedicated your life to it.
Absolutely. And really, there's not a reason not to, and there's every reason to do it. We're looking at 1 in 20 people will develop colon cancer, and we can prevent that. So if you're not going to be an advocate for yourself, at least talk to your spouses, talk to your loved ones, talk to your family, and encourage them, and then put yourself in their position. If you're going to encourage them to take care of themselves, listen to their advice when they tell you to take care of yourselves. There's no reason not to do this.
Yeah. Whether it's just questions for Dr. Bob Kizer, or maybe you have some symptoms you want to get checked out, give them a call, 449-4692, chihealth.com, gastroenterology. Doctor, thanks for your time this morning. And I like all my dentist friends out there, but I'd rather have a colonoscopy twice a year than go to the dentist twice a year.
Isn't it amazing that's how comfortable it's become? And then you get the day to just nap and eat all day. It's like a guaranteed Saturday.
Hey,
it's wonderful.
You're good to go.
Thanks,
Thanks
Dr.
a lot. Thanks for your
Kizer.
time this morning.
We appreciate it.